Good morning, everyone. I'm Rahul Nanuhal, COO at Cureka.com, and today we're going to talk about childhood vaccination questions. We have got a very special guest with us, Dr. Sujitha Natarajan, who is a very well-known pediatrician, and she's going to answer your queries on childhood vaccination. Before going to that, let me give you a quick introduction about Cureka.com. Cureka, as the name suggests, it is a combination of two words, cure plus Eureka, which means discover your cure. Today, it is one of the go-to platforms for millions of Indians for their healthcare needs, be it nutritional, wellness, skin care, hair care, elderly care, pain management. More than 450 brands trust Cureka to distribute their products to the people of India. And we have got love from millions of Indians who keep on coming back to us asking for the healthcare advice as well as the curated products from the doctors. Each and every product on Cureka is handpicked by doctors to ensure it is wonderful for a healthy living. You can use it even while you are undergoing any treatment, concern, or in general to have a healthy living. So coming back to our very special guest today, we have got Dr. Sujitha Natarajan.
Hello everyone. As a parent, I think many people have so much doubts regarding vaccines and many are reluctant to get the vaccines. So I think this session will help you to clear so much doubts about the vaccines.
Yeah, thank you so much, Dr. Sujitha. We're going to cover a number of questions that parents have asked us over a period of past 1 week. First question for you would be, what are the benefits of vaccinating your child?
Benefits of vaccination. The vaccines actually now has came into the market as prevents actually more than 20 deadliest diseases. This not only protects the diseases but also prevents the child from getting the complication even if the child gets the vaccination. This vaccine, once the child gets the vaccination, the child has this susceptibility to the infection as well as the spread of infection to the community is also reduced. And in our current practice, now many antibiotics becomes resistant to infection. So once a child gets vaccinated, they are also protected from these antibiotic resistant infection. And another thing you know about the herd immunity, which is nothing but the people who get vaccinated protects the person who's also not got vaccinated, because in a community if so many people gets vaccinated, this in the vaccines, because of this many people won't get this disease because so many people have got vaccinated. So it's better to get vaccinated.
Correct. So let's go with Dr. Sujitha's advice, and everyone should get vaccinated. Now, there are some parents who are worried about some of the dangers of vaccinating your child. So what could be the dangers of vaccinating your child?
If the child has not been vaccinated, they are more prone for infections such as pneumonia, TB, diphtheria, because this infections can cause so much complication to the children, especially during the first 5 years of life. Because the first 5 years of life is crucial for the child's development and growth. So it's better to give vaccination to prevent these infections. As well as if the child was not vaccinated, they are more prone to get complication than the child who is vaccinated. So it poses a burden both on the parents as well as children, and their school days has been reduced and they are more prone for infections and they have been more concentrated in hospital stay than having a good quality of life. As well as this, because if the child is not vaccinated, the persons who are with the child are also more prone for infections. So it's better to get vaccinated than treating after it comes.
Right. And in any case, if you have got any questions or you are feeling overwhelmed by vaccinating your child, go see a pediatrician. They are the best ones who can guide you what are the right timelines to vaccinate your child. Next is, how does the vaccine works, doctor?
Many people will think how a vaccine can protect the infection, right? Because vaccine is nothing but it is actually a mild infection we are injecting into the child so that the child can produce antibodies against that infection. It will take some 4 weeks or more than 4 weeks to develop antibodies. Once the child gets these antibodies, when the child again exposed to the same infection, these antibodies will recognize that infection and fight against the infection. That's why the child who is vaccinated or becoming immune to that infections. And moreover, after giving vaccination, many child can get fever because we are actually injecting a mild infection which is harmless only. The fever will be for just for 24 hours and then it will go away. So you need not worry about the fever after vaccination.
So a lot of people would be having this question. I'm sure this is answered for you now by Dr. Sujitha. In case you have any further questions, please drop in your comments. We have got a number of users coming in right now. Please drop in your questions in the comments so that we get to know and Dr. Sujitha get to answer them in this very live session for you. So the next question for you, Dr. Sujitha, is vaccine safety. What do we need to know about a vaccine safety?
Actually, what are vaccines available now is actually FDA approved vaccines. It has been trialed and then only came into practice. So all vaccines are being safe to be administered. So before getting a vaccine, you should first consult a pediatrician and you have an immunization schedule. It should be followed according to the respective age because some vaccines should be given according to the respective age and weight of the child. So first you have to contact a pediatrician. The pediatrician will see your child and they'll ask some questions because some vaccines should not be given to the child. So they'll ask about your allergy history or previous any allergy history for any vaccination or any seizure or any medications. Everything you have to be clearly explaining the pediatrician because if you clearly tell only, there won't be any vaccine side effects because some vaccines have some side effects also, but better we have the questions before so that it will be easy for the parents as well as doctors also. And after that we have to see the child first fully. We have to check for the fever, everything. Only in case of the fever, if it is more than 101, we won't give vaccination. Other than that, if mild cough and cold, we can also give vaccination. And the vaccines has to be stored in a particular temperature. Each vaccine should be stored in a particular temperature and it has to be a sterile technique. If you use a syringe, it has to be sterile and it has to be disposed immediately. So I think it's safe. Vaccine is very much safe if you follow a particular protocols according to the schedules.
Wonderful, wonderful, Dr. Sujitha. So there are a number of things that Dr. Sujitha informed us just now. So one of them is that you have to take care of your child when he might be sick, might be having fever. Until 101 fever, it's okay, but after that you should go see a pediatrician. And in that case, the vaccination may not be suitable for that particular moment of time. And other thing would be the child's, you mentioned about the child's allergic history. So if your child is allergic, in that case also you have to ask the pediatrician, inform him about child's allergic history prior to the vaccination. Right, moving on to our next question. We have got a question coming in from one of our listeners who is Premalata. She's saying, after vaccination, my son got lump on the thigh for more than 3 weeks and used topical creams as suggested by the doctor. How to avoid that in the future vaccination? Any home remedy?
Actually, normally we'll get swelling after vaccination, but it will go within 1 week or 2 weeks. But when it is more than 3 weeks, then it might be when they would have not given a proper technique. Because each vaccine has different route of administration. If they have not given properly, some might get this lump. But it is, you need not worry unless it is painful or any oozing is coming from the swelling. If any pain or oozing is coming from the swelling, you should not treat it on yourself. You should just visit a pediatrician because sometimes it might get into infection and it might go to sepsis also. So you better consult a pediatrician. Next time you properly inform the pediatrician that this child had previously the same thing. So they'll use a proper technique and they'll use a site other than previous site also. Actually, it's normal only within 2 weeks you can wait. After 2 weeks, if it is still there, you should immediately see the pediatrician. Don't use any topicals as of now without consulting a pediatrician.
Wonderful. I'm sure your question is answered, Premalata. And she also asked about any home remedy, doctor.
Just for 2 weeks, you can just apply a cold compression alone. Just
Cold
a
compression.
cold compression. Don't do a hot compression because it can make painful. Because cold compression is better, but only if the swelling is mild. If the swelling is mild, you can use cold compression. If the swelling is only increasing in size and it's painful, you should consult a doctor.
Pediatrician.
You can actually wait for 2 weeks for the swelling to reduce.
Sure. So we've got some guests coming in. Mr. Zabelico, he's asking for arthritis related questions. So arthritis is covered in our another video by well-known Dr. Satish Devadas. You can have a look at that video, my dear, and we'll come back to you on the queries after this video. Now we have got another question coming in from a parent which says that what are contraindications for vaccine, doctor?
Actually, I have mentioned if the fever is high grade fever, it is more than 101, we should not give vaccination at the time. We should treat the patient and then ask them once they settle, they can come for vaccination. And normal cough and cold, we can give vaccination. And if the child has any allergic history previously, then we should not give a vaccination because certain child has allergic to egg. Because some vaccines such as flu and yellow fever vaccine which has an egg protein. So it's better if a child has an allergic to these vaccines, we should avoid allergic to egg protein, we should avoid these vaccines. And if they already have a history of any fix after getting vaccination, we should avoid vaccination for these kids. Because I think many people have got idea that DPT vaccine, that is diphtheria, pertussis, tetanus vaccine, can cause, which is very rare, but it can cause fix in some infants. If the child gets fixed with this vaccine, we can go to the another combination vaccine. Because mostly that is a whole cell vaccine only will cause the seizure. But if the child has this history of seizure, then we can go for acellular vaccine which is available in the market. We can go for that vaccines. And moreover, many children with some HIV or cancer, for this vaccine such as live vaccine, such as BCG, polio should be avoided in these children. And this rotavirus vaccine, which is we will be giving for diarrhea, should not be given more than 8 months of age. So it's better to give before itself. We should cover this 3 doses because this, if we give more than 8 months of age, this can cause an intestinal infection also. So you have to tell the proper history so that the doctor can easily identify which vaccines will be suitable for your child.
Wonderful. So these are a lot of good insights for a wide variety of parents. Dr. Sujitha has covered a number of kids treatment concerns, whether it is for an HIV positive kid or whether it is for a kid having cancer and multiple other children. I'm sure you'll find this very, very helpful. Do ask your questions in the comments below and we will take it up in this session. And also if you got any relative or any neighbor or any friend of yours who might be benefited with this video, please pass on and share this video to them as well. So now we have got a question coming in from Selvam. He says, my son is 5 years old. Does he need any vaccine?
Yeah, 5 years. Because what all vaccines we would have given till 1.5 years, that vaccines booster should be given at 5 years. So you should actually get the vaccine at 5 years also. There's a schedule will be there because some vaccines gives protection till 5 years only. So we have to update it. So we have to give a booster dose for the vaccines what your son has previously received. You have to get a booster dose at 5 years of age also.
Any special vaccine which needs booster dose, doctor?
Yeah, what we have mentioned like DPT, which is diphtheria, pertussis and tetanus. That vaccines has to be we have to get a booster dose for the vaccines, as well as chickenpox we have to get a second dose also, and even MMR, which is measles, mumps, rubella, we have to get the booster dose at 5 years of age also, because these vaccines gives protection till 5 years only, but beyond 5 years you need protection, so we have to get a booster dose also. So you have to definitely get a booster dose at 5 years of age.
Wonderful, wonderful. Right, I'm sure your question is answered, Selvam. So, and Premalata has come back to us saying that her son had no pain or oozing, and thank you, doctor, for the reply. Yeah, so another point she has mentioned just now is that how often should my child receive booster shots?
It depends upon the vaccination. Each vaccine has a different booster interval. Likewise, I already told that DTP and MMR, what we have given at 1.5 years, that vaccine needs a booster at like 5 years of age. If you have given pneumococcal vaccines, we'll be giving a booster after 6 months. So each vaccine has a different interval for booster vaccine. So it's better you contact a pediatrician. They'll give an idea about this booster dose also. But you have to get the booster dose, because if you have not got the booster dose, whatever vaccines previously you received won't give protections beyond that booster level.
Right. I'm sure your question is answered, Prema. Moving on, we have got another question with us, which says that what if we missed the vaccination? I'm sure this question is for a lot of parents, even for my kids. We miss vaccination sometimes. We forget about them because of our busy schedules. Now, what if we miss vaccination during the pandemic specifically, or for any other reason, let's say?
Yeah, now because of this pandemic, many people have missed a lot of vaccine because they were reluctant to go and get vaccine, and there was a myth that getting vaccination will increase your susceptibility to COVID. So many people avoided vaccines during this pandemic time. But even if you have missed that vaccines, you can get now. You need not worry about that. You can contact your pediatrician and they will check your schedule and they can give the catch-up vaccination. If you have so much vaccinations in pending, like 5 or 6 vaccines you have been missed during this pandemic period, the vaccines which is more important now, they'll give that vaccines now. Like with the first, if the 2 vaccines is important now, they'll give that vaccines now, and they can schedule the other remaining vaccines 1 month interval, so that you can get the vaccine full scheduled by 5 years of age, because this 1 to 5 years is a crucial time. If you have missed any vaccines in this 1 to 5 years of age, you should get it immediately.
Right. So, continuing with the same question, a lot of parents have got an hesitancy towards getting their kids vaccinated. So, vaccine hesitancy and how to overcome it, doctor?
Yeah, many people have a vaccine hesitancy. They are asking what all diseases are not there, why we have to vaccinate the children? Because we have given vaccines only, there is reduction in the infection also. So whatever vaccines we have given previously only protecting our kids, and it will protect the future generation also. So it's we have to clearly explain the parents about the vaccines benefits, and not getting vaccines will what happens to child, everything we have to clearly explain in their simple language. And because of vaccination only, we have eradicated smallpox from the world. So now we are not getting smallpox vaccines. Previously, before the 20 decades back, they would have got vaccines for smallpox. But now we have eradicated, now we are not getting smallpox vaccines. As well as polio is also being eliminated in India, but we are trying to eliminate from the world also. Yeah. So if we give vaccine, it will not only protect your child, it will protect your future generation. So you have to think about these vaccines, and don't believe on such social media posts about various side effects of vaccines. It is better to prevent the infection than treating after it comes. So better you can prevent it by easy means of giving a vaccine which has only less side effects, which is very rare also to get the side effects. So you better protect your child with vaccines.
Sure. Absolutely. That would answer a lot of questions and clear the doubts of parents who are hesitant in getting their kids vaccinated. Moving on, we have got a question from one of our listeners, Syed. And Syed says, my sister's baby is 3 years old, and kindly suggest me which supplement is suitable for her.
Which supplement?
I'm not sure, because Syed, you have to come across with something more specific in terms of if she is food or medicine, or if she is having some specific concern regarding which you are asking. Yeah, so in the meantime, we'll move on to our next question: vaccines and autism. So, what are the myths that are going around autism and vaccination for autistic children?
Actually, there is many myths going on. Till many educated people is also believing that vaccines can cause autism. Previously, they are thought that MMR vaccine, there is measles, mumps, rubella vaccine, which will be giving at 10 months and 1.5 years. They thought that these vaccines will cause autism, but still now there is no proven studies to prove that. These MMR vaccines won't cause autism. Why these came into this? Because autism mostly develops at this age. So they thought that because of this vaccines, a child is getting autism. But that is not true. But now there is increased incidence of autism because many people came to aware of this autism. And autism is mostly due to genetic disorder. So it doesn't have any correlation with vaccine. It has nothing to do with vaccines. So you can actually get vaccines, MMR vaccines that won't cause autism.
So are there any changes, doctor, for autistic children, or they have to follow the same regimen, the same schedule for their vaccination?
There is no such a separate schedule for autistic children. They can get whatever vaccines a normal children is getting because it is a developmental disorder. These child requires proper counseling, occupational therapy, nothing. Other than that, whatever vaccines a normal child is getting, the same vaccines can be given to autistic child. There is no harmful effects from the vaccines.
Alright. So I think this would help a lot of parents, and I'm sure if your near and dear ones or someone in your network needs to listen to this, please pass on this video to them. Moving on, we have got what are the latest vaccine recommendations that have come in recently?
Previously, you would have heard that after 10 years we'll be giving TT vaccines, but now we have advanced it to Tdap because previously we'll be giving TT, it will cover only tetanus. But now we are giving Tdap, which includes diphtheria and this pertussis. Pertussis is nothing but whooping cough. Why? Because now there is an increased incidence in this pertussis and diphtheria. So we are covering that vaccines in 10-year-old child also. So now you should not give TT for a 10-year-old child. You should contact a pediatrician. They will be giving a new updated vaccine, which is Tdap, which gives tetanus, diphtheria as well as pertussis. It covers these three. Even pregnant women now they are not getting TT. Now they have been advanced to Tdap, and moreover many vaccines have been came into practice which can protect your child, such as pneumococcal vaccine. This pneumococcal vaccine is essential especially for preterms. Preterms children should get pneumococcal vaccine because they are more prone for pneumonia. These vaccines has been scheduled along with the DPT vaccine you will be receiving at 6, 10 and 14 weeks as well as at 1.5 years of age. Along with this vaccine, you can actually get pneumococcal vaccine for your preterm kids as well as the kids who is already been asthmatic or any nebulization. These child should get a pneumococcal vaccine. And another thing, meningococcal vaccine, which is many people have no idea about this meningococcal vaccine. This meningococcal is nothing but this will produce a brain fever. This will protect against the brain fever, which is more common within 5 years of age. At least one dose of meningococcal vaccine can protect your children from brain fever. So you can get this meningococcal vaccine. And another thing is now currently many flu viruses has been increased now. So many children is getting sick from flu. So you can actually get a flu vaccine. So flu vaccines are many available in this market. You can actually get a flu shot just before this winter season, such as September, October. Before that season itself, you can get the vaccine. These actually protects about 80 to 90% of the flu virus. And for flu vaccines alone, you have to get it again every year because the strains will change every year. So you have to update every year. You have to get a flu shot just before this flu seasons. And many think about adolescent girls vaccine is also available, which is HPV. To prevent HPV, this is human papilloma virus that causes cervical cancers in many of the girls. So it's better to get a vaccine for adolescent girls more than 9 years of age. You can get a vaccine like 2 doses 6 months apart can protect your adolescent girls from getting cervical cancer in the future. So I think these vaccines should be covered for your children also.
Wonderful, wonderful. I'm sure these are a lot of insightful comments by Dr. Sujitha, which will help a lot of parents to do. Check out this video again if you are not very clear of what Dr. Sujitha has just shared the information on. She has covered a lot of topics right now. Pass on this video to a lot of friends and in your network. So moving on to our last question of the day, because we are about to wind up our session. It's about 30 minutes now. So what are the vaccines that parents should consider before traveling?
Actually, vaccines, whatever vaccines in the vaccination schedule, the child should get. But if you are planning to travel any country or anything, you have to get certain vaccines according to their country's protocols. Each country has a specific protocols for vaccination. You have to get the vaccination. So it's better before traveling 1 month prior, you should book an appointment with your pediatrician. They can give an idea about what all vaccines to be given before traveling. If suppose if you are traveling to Africa or America, there is more prevalence for yellow fever. But in our India, we don't have yellow fever, so we need not get vaccine. But if you are planning to go like Africa or America, then you have to get an yellow fever vaccine, at least one dose, 1 month prior to this travel. And this Japanese encephalitis, we have to get vaccines for this. Japanese encephalitis, nothing but which is a brain fever caused by mosquitoes. This vaccines also you should be getting even if you are planning to go any Asia area also. This one dose to be get, you should get. And this for typhoid, 1 week before, at least before traveling, you should get typhoid vaccines. As well as these are the optional vaccines you should get, but you have to be updated with your normal vaccination schedule. Then only you can travel to the other countries also. So it's better 1 month prior you can get the vaccination, because vaccines takes at least 1 month to act.
Right. So there are some geographical specific vaccinations which Dr. Sujitha just informed to us. Go visit your pediatrician before traveling so that you are aware of which vaccination is suitable and required by you for your kids. Now we have got a question coming in from one of the guests, and he says, Selvam asks, is there any special vaccine for girl child 6 years old?
6 years old you need not get vaccine, but I already told after 9 years of age, the girl child should get a vaccine against HPV, that is human papilloma virus. We have vaccination for that. That is 2 doses should be given, like 6 months gap. That should be given after 9 years of age. But 6 months you need not get any vaccines. Till 9 years, what all vaccines in the schedule you can get. But after 9 years, you can get this HPV vaccine, which is especially for girls. And I have not told about COVID vaccines. I have to give us some information about COVID vaccines also. Now in India, there is a COVID vaccine has been practiced only after 12 years of age, because we can get after 12 years we can get a vaccine, which is Covaxin has been approved for the children. We can give 2 doses like 1 month apart. But in other countries they have started like after 6 months itself. I think it will come into practice, so it's better to get vaccine against COVID, because this will protect against your kids. Even after vaccination, you can a child can get COVID, but the complication will be very less. So better to get COVID vaccine after 12 years of age. You can now 12 to 18 years of age. COVID vaccines is available. You can go and get the COVID vaccines also. It's actually no harmless. It's harmless. There is no side effects for COVID vaccine. Even if you have got COVID vaccine, you can get other vaccines in the schedule also. They won't do any harm to this thing.
Right. So just to summarize, Dr. Sujitha has just mentioned that we should take care of our children, like answering Selvam's question. As per the schedule, please carry on with your vaccination, and after 9 years of age, you would require some vaccination. Then Dr. Sujitha mentioned about COVID vaccination, which is offered by government these days, and you should go and get your kids who are above 12 years of age vaccinated, because there is absolutely no side effects about them. And Dr. Sujitha has also told that in case if you have any more questions around your vaccination, you should consult your pediatrician. Now we have got another question from Pandi RPS. He says, hi ma'am, my baby is 5 months old. Which natural foods should be suggested to my baby?
Yeah, till 5 months of age, you'll be giving a breastfeeding only, because breastfeeding can give so much immunity to the child. So after 5 months, you can start giving complementary feeds, but you have to continue the breastfeeding also. What are foods you should start slowly, like you can give this ragi, but first you have to start with liquid. You can then go to semi-solid, then you can go to solid. You can even give rice, smashed potatoes, everything with little salt you can start. But I think natural foods is better than giving artificial foods. So, but even after giving foods also, you should continue your breastfeeding. And I tell you, don't give all the foods at a time, because each child will take some time to adapt for this. So if you are giving a particular food, you give it for 3 to 4 days the same food, because the child gets adapted to that food. Then you can slowly include other food also. Like I already told, ragi foods can be given. Even you can give rice, dal, everything little smashed, like semi-liquid, you can start. And you should continue your breastfeeding till 1 year of age also.
Right. So natural foods are suitable and good for your baby, for your infant child, along with the breastfeeding. That's what Dr. Sujitha informed us just now. We've got another question from Syed. He says, we gave all vaccines, but still kids get chicken pox. Is there any way to avoid that?
If you have got chicken pox vaccine, you could have 80 to 90% you won't get chicken pox again. But if you have already got chicken pox after receiving vaccine, this chicken pox itself will give your child immunity for another 20 to 25 years. So you need not worry about, because this chicken pox, once the child gets, they are immune to chicken pox for 20 to 25 years. I think they need not worry about chicken pox now, because once the child gets chicken pox, they got the antibodies and immunity against it. So I think you need not worry about chicken pox now, because your child already got it. Your child won't get it for another 20 to 25 years.
Right. But in case for the other parents who have got their kids vaccinated against chicken pox, how to avoid it even though they have vaccination?
Yeah, that is a 10% chance you can get chicken pox after vaccination also. If any child has started getting the boils of chicken, this chicken pox, you should actually isolate the child. You should not ask the child to roam around, because, and moreover, the child won't spread during initial stage. Only when it dries and crust, when it starts falling off, after 5 to 7 days only this chicken pox can spread. So before that initial period itself, you start isolating the child with mild symptoms and boils. You can isolate the child and you can protect other child from getting the infection also.
Yeah, because it spreads.
Because it spreads, it's actually a contagious. So you can actually protect other child by keeping that child in isolation for at least 2 weeks.
Right. And then in what time they should see a pediatrician? As soon as they get the symptoms?
Actually, chicken pox doesn't need any treatment. If you're proper isolation, hydration, everything, it's good. But if the child has a high grade fever along with chicken pox, then they have some superadded infection. So that time you have to consult a doctor, because the child might require any other medications for the fever also. So otherwise you need not see doctor for chicken pox. You can actually isolate the child for 1 week. The chicken pox will heal on its own. You need not worry about it.
Right. That's very insightful, doctor. Coming on to another question from one of the listeners. He said, Premlata has come with a question which she says, is there any vaccine to avoid cervical cancer or breast cancer in future?
Yeah, already I told cervical cancer proved vaccine is the virus which causes cervical cancer is human papilloma virus. So vaccines has been in the market that should be given to the adolescent girls after 9 years of age. Even 9 to 18 years, anytime you can get 2 vaccines, like 6 months apart, you can get the vaccine. These vaccines has been protecting the children as well as girls from cervical cancer.
Wonderful. So we have got enormous insights today from Dr. Sujitha. Thank you so much, Dr. Sujitha, for joining us today. And I'm sure this session has been very insightful, very useful for you. And do share this video, do share your comments. How did you like this video? And if you have got any other questions for us that you would like to ask the doctor. So here is your host for tonight, Rahul Nanuhal, CEO of Cureka.com. Do let us know your questions on our website Cureka.com. Also, we've got a WhatsApp platform on which you can ask questions from any doctors or recommendations for products, for concerns, for any treatments. And thank you so much, Dr. Sujitha, today. Any parting words to the guests?
Actually, thank you so much for bringing in this interesting topic, because this many parents has so much doubts regarding these vaccines. I think this would have cleared some of their doubts. Even if you have some doubts, you can kindly share this. I'll ready to clear all your doubts, and you can also visit us and we can give you more knowledge about these vaccines, and you should get your children vaccinated, because I'm repeating this.